Hey, good afternoon. I'm Major General Tony Agudo, the commander of 3rd Infantry Division and the senior mission commander for Fort Stewart and Hunter Army Airfield. With me, I have the garrison commander, Colonel Brian Logan, and the Wynn Army Community Hospital commander, Colonel Michelle Monroe. Together, today we are going to provide you an update on where we are with coronavirus and the status of our installation as of March 17th. Now wait, stop, don't turn off your phone, don't click us off. I promise you we have some important stuff to tell you, and we will try to keep you as entertained as best we can. First, I cannot stress enough, we do not have a confirmed case of COVID-19 in our area. We are, however, taking all necessary precautions to prevent the spread of the illness. We are all in this together, and collectively, by taking these actions, we can protect ourselves, the ones we love, and keep our soldiers ready. As many of you know, in conjunction with our local school districts, we have closed DoDEA schools for the time being. DoDEA staff will be on hand to answer your questions, and we will start serving grab-and-go meals at one of the elementary school locations on Monday. Specific details to follow. Please ask and follow up with your chain of command. Now, many of you have seen, and if you have not, I've published some latest guidance on the last March 6th sends. I wrote this, it was posted to social media and on the app yesterday evening, and even if you have read it, here are some of the latest directives effective immediately. We are restricting movement in Savannah for service members. Specifically, service members will avoid all large gatherings, mass events, to include restaurants, bars, and nightclubs north of Broughton Street in Savannah, Georgia. This includes the City Market, River Street, and the Historic District. This directive is made in an attempt to reduce the introduction of the virus throughout our community, and my top priority is the readiness of our force and the health and safety and welfare of our loved ones and community. Those on leave or not in the Savannah area, I ask that you use the same discretion in avoiding similar locations, large events, and mass gatherings.
Hi teammates, your Garrison Commander, Colonel Brian Logan here. Now don't turn that phone off, we still got some more information. I'd like to talk to you a little bit about the changes that we've made for our installations both at Fort Stewart and Hunter Army Airfield. First, with our fitness centers. They remain open, but between the hours of 6 and 9 a.m., they're only open to our active duty members. We have increased cleaning and sanitation, and those are in effect for all across the fitness centers as well as our CDCs. Now we also plan to reduce our hours in our PX and commissary, primarily to allow those crews more time thoroughly clean and stock our shelves. We've also added additional cleaning crews, and we've implemented strict sanitary procedures to enter any of those establishments, such as washing your hands upon entering. There'll be soldiers there to ensure we are enforcing the standards. All of our post restaurants are going to takeout only. Many of our local restaurants are also following suit. We have closed our eating areas in our food courts and our restaurants on post. Next, we're implementing our self-scan access to the installation for Fort Stewart, starting with Gate 3. Now you'll only need to present one identification card per vehicle to those scanner kiosks. Further on in the week, we'll implement that procedure for the remaining gates on Fort Stewart and Hunter as well. Now before I turn it over to Colonel Monroe, I'd ask you that you all remember we're in this together. Please practice social distancing, good hygiene, and cleanliness. Stay informed through your official channels and continue to fight a win against COVID-19. Remember to stop the spread.
Hi, I'm Colonel Michelle Monroe. Please stay with me as I have a little bit more information for you. Our objective is to delay and flatten the peak of the pandemic so that we can minimize the number of cases across our footprint and ensure the readiness of the 3rd Infantry Division and all of our beneficiaries, and provide health awareness and care for our military community. Common sense, good hygiene, and vigilance goes a long way in helping mitigate the threat. While we are still in flu and allergy season and several symptoms of this are aligned with coronavirus or COVID-19, social distancing does help. Social distancing means minimizing the contact you have with other people. It also means that if you are near someone in public, try to stay at least 6 feet away from them. The less contact people have with one another means the less opportunity for the virus to spread. Slowing the spread of the virus means we can keep our healthcare system from being overwhelmed. At this time, there are no reported cases of COVID-19 or coronavirus on Fort Stewart or Hunter Army Airfield. You can help stop the spread by adopting personal behaviors. More frequent and more thorough hand washing for at least 20 seconds with soap and water. Stay home if you are sick. Avoid handshakes, hugs, and large public gatherings of 10 or more. Avoid unnecessary social contact. Avoiding unnecessary social contact is especially important for those who are pregnant with pre-existing health conditions or are over the age of 60. If you are exhibiting symptoms to include fever over 104 degrees, cough, and/or difficulty breathing, you should stay at home and stay away from others. But if for some reason you may need to seek health care, reach out to our nurse advice line at 1-800-TRICARE 874-2273, option 1. Another resource is the State of Georgia's hotline at 1-844-442-2681. Self-isolation helps reduce the threat the disease will spread, especially to those who are susceptible. Now, you may have heard two different words that we've been using on a regular basis within our community. That's quarantine and isolation. Quarantine is used to identify an individual who has traveled from an area of high risk or has had contact with a confirmed case of COVID-19 or coronavirus. We will place someone in quarantine for 14 days to see if symptoms develop. If symptoms don't develop, we can assume they weren't infected. If a person develops symptoms, we will elevate them to isolation. During isolation, we ask that the individual has no contact with anyone else until their symptoms subside. With quarantine, it is required to have no contact with anyone outside your family or healthcare professional. In isolation, you're required to have contact with no one, including your family, unless they are placed in isolation with you until your symptoms subside. Soldiers will maintain their physical fitness while at home. Right now, all tests for COVID-19 is limited and requires Georgia State Public Health approval. To help mitigate the threat to individuals who are more susceptible, Wynn Army Community Hospital has made some adjustments to their visitor policy. Right now, labor and delivery is limited to only those who are over the age of 18 and one individual per laboring patient. Across our community, people are responding with amazing energy and creativity to face this challenge head on. Thank you for being part of the solution and doing your part.
Thanks, Michelle. Thanks, Brian. Look, in closing, we will continue to take the necessary precautions to protect our community. As you all know, the situation will continue to change, and we will continue to get through this together. Remember, together we are one family, one community. We must stop the spread. We are all dog-faced soldiers. Thank you, and rock of the morning.